Okay, well, here's the problem, okay, is that we train our brains to do things, and then we're surprised when they do. Okay, when you go to sleep at night, if you take your day with you, you're not going to get to bed, okay, because you're still processing information. You're breaking the training of sleep cycles. Okay, when you go to bed, you lie down in bed, turn the lights out, turn the television off, and you will go to sleep. Okay, it's that simple. If you keep yourself up with a radio, if you keep yourself up with a nightlight, if you keep yourself up with your telephone or the television, then you're going to train your brain not to sleep when it's supposed to, and it will not awaken when it should. This leads to certain changes hormonally, which in turn lead to anxiety. So you can make somebody crazy. Okay, you can make yourself crazy simply by denying yourself or denying somebody else of sleep. During the Korean War, that was our first experience with something called the Chinese water torture. And what you did was you took your victim, you took your interrogatee, lied them down, and dropped just a simple drop of water onto the forehead and walked away. You didn't have to do anything more. They couldn't sleep, couldn't focus, and every drop of water was like being hit with a sledgehammer. And after 2 or 3 days of this, they would convince you that they were, in fact, they were Mao Zedong himself, okay? And that's the way the thing went. That was the lesson learned in the Korean War, and that's the lesson that we seem to learn every day. So if we allow ourselves not to sleep, anxiety will occur. So we watch the evening news. Great time to watch the news, bad time to get to bed. So what I have my patients do after the initial, gee, let's shake you up, the Etch-a-Sketch moment, is we try to reestablish a normal sleep cycle. How do you do this? Well, you can do it with the antidepressants. If your doctor thinks you're crazy, that's a great place to start. The way I really prefer to do it is to use neurotransmitters, one called GABA. You use that in combination with an amino acid called L-theanine, another one called 5-hydroxytryptophan, and then sprinkle a little bit of melatonin, and that'll knock just about anybody to, right out. You reestablish the night's rest, and you maintain the medication because it is, in fact, necessary to maintain sleep hygiene. Your body will secrete less and less melatonin as you age. Well, that might be the reason why you sleep less than you used to. It is not normal for this. It's expected because it's part of the aging process. But you really do not need to age quite as quickly as the people around you. I rather prefer to remain a bit more like Peter Pan without the leggings. What you do is you want to sleep through the evening, awaken in the morning early, and go to work. Now, what can you do to deal with the anxiety that you might have during the day? We certainly can't take a sleeping pill. It's really a bad idea to take melatonin, but you can take a little bit of L-theanine. How does this work? L-theanine is a soporific. It will settle you down, but also you get 2 bangs for your buck with this stuff. It will clear the liver out. It's a marvelous detoxification agent, and it's present in something called green tea extract. So I have my patients invest 10, 12 bucks in something called green tea extract, and you take 2 a day, 1 in the morning, 1 in the evening. Very, very, very good anxiolytic. Low-dose GABA during the day, high-dose GABA at night. We have a product in the office called Get Over It. I get to name it. Okay, what is it? It's a modest dose of GABA with L-theanine. You take it, you settle down. Is it addictive? No. Does it work? Absolutely. People love this stuff, but it's not really useful at bedtime. But during the day, the stuff is marvelous.
Wow. Now, I do that. I'm taking all those things at night. But ever since my accident, I sometimes have problems sleeping at all. And maybe it's because I'm sleeping in different places. You got the house, and then you got the hotel, and maybe that's what it is.
Well, and all those multiple girlfriends and whatnot.
Oh,
it all works.
Now, we can't do
Yeah,
that.
no, it all works. So what happens is you do become accustomed to the bed. You become accustomed to the pillow that you use.
Yep.
And as you start to move around, you are disturbing your sleep hygiene. So there are people that will travel with their very own pillow. They'll pack that pillow. They'll leave a certain amount of clothes at home because you're only allowed so much luggage these days. But the pillow itself is probably the reason why you're not sleeping. When you find a pillow that works for you, it's going to be a certain thickness, a certain density, and it will be of a certain softness. What that does is it shapes to your neck so that you don't end up hyperextending your neck or hyperflexing the neck, thereby pinching the nerves and awakening you from your sleep. It's that simple. Finding a good pillow can take years. And if you don't think that it's a big problem, find somebody who has their favorite pillow and hide it. Okay, This is bad news. You would think you were hiding a woman's shoes. Okay, no,
no.
no. The pillows, that's what it's all about. Okay, that's like death. You might as well expect to have certain parts of your body super glued shut by the time you wake up in the morning.
In past shows, you have really spoken very strongly, especially to the young people in our audiences, about take that cell phone and put it in another room.
Oh, yeah, and to you adults who think you're children, put the darn phones away. Put them away at dinner. Put them away when you're trying to hold a conversation, and certainly don't drive down the road with them. I see just as many, and I'm sure that you see just as many folks with some age on them looking at those stupid telephones as they're driving these 3,000 and 4,000 pound missiles down the street. Now, I ride a motorcycle from time to time, okay, and it doesn't bother me so much what's going on in the front of me. What really worries me is the moron behind me with a cell phone.
Now, a lot of people have also said that in addition to the L-theanine and the GABA at night, they're not watching the late night news.
You got to stop it. You've got to unplug the news. Unless it's Fox, they're okay. The rest of them, they really suck. Okay? No, don't watch anything really after about 10 o'clock. Turn the tube off. Go to sleep. You got to be careful with things like tea in the evening. You got to be careful with things like coffee for obvious reasons, caffeine being one of them. But the other one is kind of funny, and it's called fluid. Okay, the number of men that wake up in the middle of the night to urinate is remarkable. After the age of 40, it goes up because of certain issues with the prostate gland. Prostate enlarges, they can't void so well, they wake up 2, 3, sometimes 4 times at night. If you disturb your rest due to that, you are going to be every bit as agitated and anxious as anybody else in the world. So you have to be careful to shrink your prostate, and you can do that. You don't need some gloved finger doing this for you. All you really need to do to shrink the prostate back is to use something that will lower your estrogen levels. This could be silymarin, milk thistle. You can do it with D-indomethane. We have a product called No Mo Whining that works just fine for this. But I also tend to add a blood pressure pill in very, very low concentration, low dosage. And what this stuff does is it acts as a tumor necrotic factor alpha antagonist, shrinks the prostate back, and the joke is it also acts against certain cancer cells within the prostate. Medication is called Prazosin. They give it away at Publix. This stuff is very, very cheap. You start low dose with it, or you're going to find yourself face planting, because it tends to cause orthostatic hypotension. So I tell my patients to take it at night, starting with very, very small doses, sit at the side of the bed, wait, count 30 seconds, stand up, wait, count 30 seconds before you proceed to the bathroom. You increase the dosages 1 milligram, 2 milligram, 3 milligrams, 5 milligrams. By that point, the prostate starts to shrink back and you're sleeping through the night. That also helps with these anxiety issues. If you can't sleep, you're not going to feel very well rested in the morning.
All right, very good. So how early in the evening should we stop consuming liquid?
6 to 8 o'clock in the evening. It's variable. We certainly should not be consuming alcohol. Now, at about 8 o'clock in the evening, you're going to void by 10 or 11 by the time you hit your bed. Okay, it's very sensible. If you can test your own system by drinking a glass of water right now and seeing how long it takes before you have to hit that commode. One other thing that needs to be mentioned, and that's alcohol in the evening. People say, well, it helps me rest at night to take a glass of wine. Well, the joke here, and the joke is on you, okay, is that you'll go through a mini withdrawal in about 2.5 to 3 hours. So if you have a drink of alcohol at 11 o'clock, you'll be up at 2 o'clock, wide awake, or at least agitated, because you're going through a mini withdrawal from the alcohol. It's not the same thing necessarily as going through alcoholic withdrawal, but the effect is the same. Acetaldehyde gets presented to your brain. It wakes up. It does not feel happy, and you don't wake up feeling particularly well rested. So if you need something to sleep, alcohol is singularly a poor choice for this reason.
Okay, Robin, now the nutraceuticals we talked about to help you sleep, and they are over the counter, are available at the Stages of Life.
That's right. They're available in our health store, which is open Monday through Thursday, 8 to 5 in Longwood. We are located at 1917 Booth Circle. That's right off of I-4 and 434. You can give us a call at 407-679-3337, or you can search us on the web at stagesoflife.net. We're also on Facebook at Stages of Life Medical Institute.
All right, and again, the doctor will be back with us on the Resource Hour tomorrow.